I think we have enough participants to kick off as Eve starts, as Eve works on presenting. Yeah, so welcome to all our guests from My One Health and our referral partners from around the world. My name is Joseph Chebe. I will be hosting your webinar for today. So a little bit of a rundown of how this will go. I'll introduce the agenda, and then we'll have a chance for us to ask some questions and answers. And then we'll have our guest for the day present to us about their facility. And then finally, we'll have the Q&A session, and then we'll finish off the webinar. So yeah, welcome everyone. Our agenda for today is we are about to know one of our partner hospitals who's providing medical services to patients from around the world. And this is a partnership between My One Health. So My One Health is a medical facilitation company with a presence in Nairobi, Africa, and Dubai, Middle East. But we do have partners all across the world. So far, we have assisted around 48,000 international visits to various international hospitals, and we hope to achieve 1 million patients to receive outstanding medical services by 2030. And joining us today is Dexeus University Hospital, who is one of the partners that we are looking to achieve this 1 million patient mark with. Dexeus University Hospital is part of Quirónsalud group, which is the largest hospital group in Spain and the only JCI accredited hospital group in the world. So Dexeus is one of the hospitals that is under Quirónsalud. And today we want to learn about how this hospital is bringing in innovation, quality, expert doctors, infrastructure, and we also be going through some of their centers of excellence and specialization, and also get to know about their international patient experience. Yeah. So joining me today from Dexeus is Carlos Segui, who is the Director of Business Development at Dexeus. And yeah, Carlos, welcome very much. I understand it's morning in Spain. Are you in Spain?
Good afternoon, everyone. It's a pleasure for me. My name is Carlos Segui, as you mentioned, and I'm delighted to be connected with you today in order for me to convey all the information regarding the Dexeus University Hospital in Barcelona. Right now here in Barcelona, it's 10 minutes past 12 midday. Yeah.
Okay, welcome very much to our webinar today. Thank you for having us. So you can just go ahead and tell us all about the hospital. Eve has already set up the presentation, so you can go ahead and start telling us about Dexeus. Welcome very much.
Thanks, Joseph, and hello everyone. As I mentioned before, I'm Carlos from Barcelona. I'm the Business Development Director of the Quirónsalud Hospitals here in the city of Barcelona. We are representing Quirónsalud, which is the largest company, the largest hospital group in Europe right now. We can go ahead with the presentation, please. The first slide with we can go ahead with to the subsequent slide, please. That's great. Thank you very much. This is the largest hospital group in Spain, and we belong to Fresenius Helios. This is a company, a German company that is located here in Europe. Can we? Is it impossible for me to pass the slides myself, because it would be easier for me to pass the slides from myself, but I think that it's not possible, right? In order for me to control the presentation. Okay, well, that's it. Right now in Europe, we are like 58 general hospitals in Spain, located in all the different communities in Spain. We are more than 50,000 employees, 58 general hospitals, 150 outpatient centers, and more than 300 prevention centers in Spain. We also offer, next slide, please. We also offer more than 8,000 beds. And last year, for example, in the hospital group here in Spain, we did all these figures, general figures of the hospital group, with more than 10 million outpatient visits in our hospitals here in the country. We did more than 2 million emergency visits. In terms of deliveries and C-sections, for example, here in the country, we had the opportunity to deliver more than 31,000 newborns in the country. And for example, we did almost 500,000 surgeries in the country. In terms of research, I think that do you hear the building works that they are doing here or not? Because I can hear them, but is it not a noise for you?
No, there's no noise from my end. You're
Oh,
perfectly clear.
that's great, because there are building works here in my office, and I can hear them, but if it's not a noise for you, it's perfect. Great. In terms of research, last year we did more than 1,000 clinical trials, and we published almost 2,000 research studies with an impact factor of 2.20. And in terms of next slide, please. And in terms of innovation, for example, 3 years ago in Spain, we inaugurated on the first proton therapy facility in the country. We also work with state-of-the-art technology like 7 Da Vinci's robotic surgery systems and all the state-of-the-art technology that we can offer to our international patients. As you mentioned previously, in terms of quality, Quirónsalud 2 years ago, we obtained the Joint Commission International. This is the gold seal of approval. That is the most important gold seal of approval of the world, the Joint Commission International. And 2 years ago, as an enterprise, as a hospital group, we obtained the Joint Commission International, and we were the first hospital group to obtain it as a hospital group. It means that we have also different hospitals in Spain that obtained the Joint Commission International years before, but as a hospital group, we obtained it 2 years ago for first time in the world as a hospital. This is the main picture of the hospital group in Spain, but we land right now in Quirónsalud Barcelona campus. Here in Barcelona, we manage different hospitals, 8 general hospitals in the city of Barcelona, and 3 of them are international hospitals. One of them is the Dexeus University Hospital. This is a Joint Commission International hospital. We obtained the Joint Commission International 2 years ago. Next slide, please. And in the Dexeus University Hospital, we offer 166 single rooms. 4 of them are royal suites for the international patients also. And for example, we also offer 13 operating theaters. Next slide, please. And in terms of technology here in the hospital, we offer the 14 operating tables in the 13 surgical area, 1 CAT scanner, 1 PET-CT scanner, and the different state-of-the-art technology. We can, in order to have the general view of the hospital, we can watch this 2 minutes feature of the Dexeus University Hospital.
On any given day, your life can change. And we'll be there for you, by your side. On any given day, you discover that injury you thought nothing could be done about has a solution. On any given day, all these things happen and many more. Moving stories. And we care about every one of them. Because we care about you. Hospital Universitari Dexeus, Quirónsalud, health one-on-one.
It was the main picture of the hospital, the Dexeus University Hospital, located in Barcelona. In this hospital, the Dexeus University Hospital, we offer all the specialties, more than 50 in the hospital, but we can stand out these specialties like oncology. These are figures of the 3 international hospitals that we manage here in Barcelona in terms of oncology, with the 7,000 chemotherapy immunotreatments, for example, and more than 10,000 patients last 5 years, in this case, in the hospitals here in Barcelona. But we can stand out also cardiovascular diseases, neurosciences, orthopedic surgery, assisted reproduction, and obstetrics, with the deliveries that we did last year here in Barcelona, and also pediatrics. These are the figures of the 3 international hospitals that we manage in Barcelona. And we can stand out also different international renowned doctors, like in terms of traumatology, Dr. Ignacio Ginebreda, who is a pioneer of bone lengthening in dysplasia patients, for example. He's the vice president of the Spanish External Fixation Society. We also stand out Dr. Carlos Barnes. He's in charge of the Institute of Ophthalmology. He's a specialist in retina, for example. And we also stand out Dr. Raúl Abella, who is in charge of the pediatric cardiovascular surgery department. He's a pioneer in neonatal cardiac surgery in pediatrics. This is the main information regarding the Dexeus University Hospital. And this is a hospital that we are very used to welcome international patients every year. Last year, for example, we welcomed patients from around the world, from more than 90 countries in our Dexeus University Hospital. And more or less the ranking of the countries that transferred patients to our hospitals were from the Middle East countries, from the US, and also from the Russian-speaking countries. What do we offer to the international hospitals that visit the Dexeus University Hospital? For example, we have a internal team, as an international assistance team that offers everything to the different patients that visit us anytime that they come to Barcelona. This can we go to the subsequent slide, please? This is a team, a specialist team that is an internal team located in the Dexeus University Hospital in order to offer all the needs that a patient and their relatives could have when they visit the Dexeus University Hospital. Next slide, please. We also offer preparation menus certified, in this case for the Arabic people, for the Arabic patients, products certified by the Halal Institute of Spain. Next slide, please. Or we can offer also a la carte menus according to the nutritional needs of all the patients that visit us. We also we offer in the hospital daily newspapers, Wi-Fi, international TV, and it's important for the patients that visit us. We offer translation of written documentation, not only in English and Arabic, but also in other languages like Russian or like French or any language that is needed for the patient that visit us. And we know that in Barcelona, it's important when they come to our city, they are worried because of the treatment that they are going to be in the hospital. But we also know that it's important for the relatives, the families that accompany the patient, that they are maybe staying in Barcelona, maybe 1 week, maybe 1 month, maybe more than 1 month. That's why it's important for us to have our non-medical service that offer everything that is not related to the hospital, but outside of the hospital in the city, like gastronomy, like excursions, like hotels, like transportations, everything that could be needed by the relatives and the patient when they come to Barcelona. And that's why we have our non-medical service official partner in order to cover everything that is needed by the families and by the patients. Thank you so much.
All right. Thank you so much, Carlos, for that brief and very concise walkthrough of the hospital. Maybe I can ask, in terms of patient experience for our international patients, what would I expect maybe from the moment I land in the airport in Barcelona to the time I get my treatment and go back home, assuming maybe it's a case where I might need follow-up treatment even after I get back home?
What can you expect as a patient that's come to Barcelona to the Dexeus University Hospital?
Yes.
Well, when you arrive to Barcelona, first of all, with our non-medical service, you are going to be picked up at the airport, for example, in order to go to the hotel that it's maybe could be like booked by the non-medical service also from our hospital here in Barcelona in order to have it all covered. When you are in the city, we know that the patients and relatives, they come and they are worried because of the treatment, because of the procedure. But you have to know that you are going to one of the best hospitals of Europe or maybe of the world right now. It's a Joint Commission International Hospital with all the best teams, renowned international doctors that are focused to the international patients in this case, with all the state-of-the-art technology and the best facilities, 5-star hotels, more or less facilities that we offer as our best and the flagship hospital that we offer to the international patients.
Okay, thank you for that. You mentioned that you offer proton therapy services. Maybe you could mention if maybe you have an idea of some complex cancers that are treated through proton therapy.
Yeah, the proton therapy center is located in Madrid. It's not located in Barcelona, but as a company, we are called Quirónsalud company, offering 58 general hospitals in the whole country in Spain. That's why we have the link related to the different hospitals of Spain very easily. Then we are in Barcelona and we have cases that they come to Barcelona to be treated in an oncology case, for example. And when we study the case, when the oncological team study the case, and they consider, for example, in a pediatrics case, for example, that it's very typical case for the proton therapy center, and they decide that it's a typical case to transfer to the proton therapy center, we are linked. The connection is direct to the proton therapy center in Madrid, and that's why that it's really easy for us and for the family to transfer the patient to the proton therapy center to be treated, in this case in Madrid. The most of the cases of proton therapy is for the pediatrics cases because of the characteristics of the treatments in proton therapy.
Okay, yeah. So you offer proton therapy for mainly for pediatric cases. That's right.
Mainly for pediatric cases because the radiation of the proton therapy is less than the typical radiation of the other treatments. That's why the most of the cases of proton therapy center are pediatrics, but it doesn't mean that the adults can go to the proton therapy center if it's indicated by the team of oncology here in the Dexeus University Hospital.
Okay. Maybe if you can tell us, do you offer transplant services as well? Maybe liver.
Here in Spain, it's forbidden. If you are not a citizen of Spain, it's not permitted for the private hospitals to offer transplant, but we have 2 exceptions. We can do bone marrow transplants in the private hospitals and also cornea transplants. These are the 2 transplants that are permitted in the private system, health system in Spain. The rest of the transplants, they are not permitted to offer them to the non-citizens or the population that is outside of the country in Spain.
Okay, so for international patients, you only offer cornea and
bone marrow.
Bone marrow transplant. Thank you very much. I have a question here. How the process for Asian patients is, especially from Bangladesh, if they want to make payment before flying in to Spain for treatment?
Well, it's really easy because we have the international team dedicated to the international patients, right? Then we have the link with the person who is in charge of the international department in the Dexeus University Hospital, and we have the direct email with this person. Then you put in contact with this person who is Miss Carmen in this case, and she received all the documentation, all the details regarding the patients that would like to be treated in the Dexeus University Hospital here in Barcelona, right? When Carmen received all this information, she assessed the information with the team or the institute or the doctor that is going to be the reference for this patient. We assess all the information and then we give the answer to the patient or to the agency that it's sending all this information. When they decide that they would like to come to Barcelona to be treated because they are like convinced with explanations of the doctors, the connection with Miss Carmen or the maybe payment that is going to be done, our hospital group will send all the details, bank details, in order to receive the first payment and then to come to the hospital. But it's not mandatory for us to have this first payment. Then if the patient would like to come to Barcelona, it's like so easy that it's only you have to take the visit for maybe next 2 weeks, 3 weeks, next month, for example, and we are going to welcome the patient at the arrival to Barcelona in order to follow all the steps.
Okay, thank you very much for that. Do you accept medical reports in other languages apart from English and Spanish?
Yes, of course. We can receive the medical reports in each language, and we have our own international team that will translate it and to give the response. We have to say that the official quotes, the official language, it's English, right?
Yeah.
But we know that we can receive different reports, maybe in Russian, maybe in Arabic, maybe in other languages. But the most of the times, we are very used to welcome or to receive the reports in English as the official, like clinical language. But it's not an issue for us to welcome or to receive reports in other languages.
Okay, a follow-up question in translation services. Apart from written translation services, you did allude that you have interpretation services for international patients who come in from maybe the Middle East and they can only speak Arabic, or maybe India where they can only speak Hindu, or Russia where they can only speak Russian. Is that true?
Yeah. This is we have the international teams dedicated to international patients, and we can do the translation of the different languages. It's true that it's very common for us to welcome different patients from around the world that they speak English, and Arabic patients, Russian-speaking patients. It's not very common for us to welcome patients from India, for example. In this case, we should try to incorporate or to check the possibility to be like translated to Hindi, but we've never had this type of need so far. But if it's needed because the patient from India cannot speak in English, for example, we should like find a translator in Hindi, of course.
Okay. Do you offer teleconsultation services? Maybe before a patient travels in, they can have an online video consultation with the doctor?
Yes, we offer video consultations from our hospitals, and the most of the doctors are very used to do this type of teleconsultation. First of all, in order for the patient to understand better the assessment of the doctor and to have a conversation with the doctor in order to convince themselves to come to Barcelona to be treated.
Okay, and for video consultation or online consultations, is it a standard fee for all doctors and procedures, or does it depend on the doctor?
It depends on the doctor. It depends on the specialty, because it's not the same, for example, an oncology video consultation, which is really like deep in order to understand and to explain all the assessment of the treatment. And that's why we have different rates of video consultation. They are from 350, no, sorry, it's like 300 euros, sorry, 350 euros, sorry, and to more or less 700 euros.
Okay, so the video consultation it could be anywhere between 350 euros to 700 euros.
Yes, yeah.
Okay, yeah. Do you support visa for invitation letters, for medical invitation letters? Let me rephrase. Yeah, so maybe a patient wants to come into Spain for treatment. Can you give them a letter of invitation to come for treatment to help with the visa?
Yeah, absolutely. So yeah, there are some countries, for example, that they need an invitation letter from the hospital with the consultation day and the specialty, for example, and the name of the doctor. That's why we send invitation letters if are needed.
Okay, thank you very much. And I guess for different cases, maybe I should ask on the centers of excellence, something to do maybe orthopedic, and is there orthopedic surgery, hip replacements or something of the sort?
Yes, we can stand up. Well, we offer more than 50 specialties.
Okay.
But we stand out oncology, orthopedics, neurosciences, pediatrics, obstetrics, and the fertility, and also, for example, reconstructive and plastic surgery. These are the main, and cardiology, of course, the cardiovascular disease. These are the main specialties that we can offer here.
Yeah, are there rehabilitation programs for that as well, orthopedic and neuro, after the procedures?
Yes. We in the Dexeus University Hospital, these are one of the best orthopedics and trauma teams that we can offer in Europe. I'm completely sure, because they are specialists in each part of the body, and that's why everything in the Institute of Traumatology is covered by the team of traumatology in each specialty. Like, for example, Dr. Ginevra, who I mentioned before, as the lower extremities of the body, like the specialist in bone lengthening, for example. But we have each doctor related to each part of the body in terms of traumatology.
Okay, yeah. Sorry to take you back to visa invitations.
Yes.
Visa invitation letters. Is there maybe an amount or deposit needed for you guys to send in an invitation letter?
No, it's not needed an amount of money. We can send, when we have all the documentation of the patient, we can assess the treatment. We send the treatment assessed by our doctors, and we can give the visit for a day in the next weeks, for example. We can send the invitation letter to the patient, and for them maybe to check it with the embassy, for example, in their country, in order to have the visit to come to Spain.
Okay. I think that's more or less like it from the questions. I hope we have all been satisfied with what Carlos has given us. Thank you so much. I am seeing one more question coming. What is the inquiry turnaround? Maybe let's say our patient support team slides in a patient maybe today. What turnaround should we expect for the inquiry?
But the inquiry turn around time, when you send the assessment of the patient, how long does it take to us to have the response? Or when they want to come to visit in Barcelona, how long do we take to give you the visit? I don't understand which one.
No, the first one, when we maybe send in medical reports for a patient, how long it takes for the doctor to review them and then get back to us.
In 48, 72 hours, we try always to have the answer. Okay. Sometimes you know that the doctors are very busy and maybe it takes a bit longer, but we try that in 48 and 72 hours have the answer for the patients.
Oh yeah, that's what I meant. But thank you so much for answering the question, and thank you so much for helping us understand the hospital a bit better. I went through the hospital and saw that it's a very good facility. Maybe are there specialists that are available Monday through Sunday, or do they work specific days of the week?
Sorry, can
In
you repeat? Sorry, I couldn't hear fully. So,
for specialized cases, maybe for big specialized cases, oncology, orthopedics, that kind of thing, are the specialists available 24/7 Monday to Sunday, or are there certain days that they are available for consultations?
well, for consultations, here in Spain, we work from Monday to Friday. And that's why then the reality is that we work from Monday to Friday. If you send, for example, a medical report on Friday night, we are going to have the option to check it from Monday morning, for example, right?
Yeah. Okay. Thank you very much. Do you cover IVF as well?
Yes, yeah. We have a very good team of IVF here in our Dexeus University Hospital.
Okay. Thank you very much. I do not see any more questions streaming in. Yeah, and I thank you for coming in. And yeah, all the best. I hope this will be a very fruitful partnership. And I hope all the people who have joined in the webinar have been satisfied by what we have given. And yeah, thank you very much, Carlos.
Thanks to you. It's been a pleasure. Thank you very much. Have a nice day.
You too. Have a nice day.